Aaron Pierce, and I'm here to inform you about preoperative evaluation and preparation in elective surgical patients. Preoperative assessment and evaluation is used to properly prepare a patient to undergo elective surgery and plays a critical role in maintaining patient safety. The main focus of preoperative evaluation, assessment, and preparation is making sure that patients are at an optimal level of health prior to surgery. Patients that are not properly evaluated and prepared for surgery are at risk for last-minute cancellations or delays on the day of surgery, which can lead to decreased patient satisfaction and outcomes. By ensuring that patients have thorough assessment and evaluation prior to surgery, we can decrease this risk of cancellations and increase patient satisfaction and outcomes, which is so important in healthcare today. Proper preoperative assessment and evaluation includes a thorough review of the patient's medical history, physical examination, and any further evaluation or consultations deemed appropriate from the history or exam. In an article from American Family Physician website entitled Preoperative Evaluation, Dr. Mitchell King states, the purpose of preoperative evaluation is not to clear a patient, but evaluate, and if necessary, implement treatment to better prepare higher risk patients for surgery. The physician performing the preoperative evaluation must understand the level of risk of the patient's surgery and how it relates to their health conditions. This assessment and evaluation must be done prior to the day of surgery, but not too far ahead of time that the health conditions could change. The preoperative assessment and evaluation can be done by the patient's primary care provider or other consulting physician if a patient has known medical problems. It is important as well for a patient to be seen preoperatively in the pre-admission testing department of the hospital that the surgery is scheduled for. At this appointment, they can be seen by a nurse and the anesthesiologist in order to be better prepared for the day of surgery. The Agency for Healthcare Research and Quality's perioperative protocol guideline states that all patients scheduled for elective surgery must undergo a basic health assessment. This basic health assessment must include a complete medical history and physical exam. The medical history is perhaps the most important information obtained. This includes allergies, known medical problems, surgical history, list of medications with dosages, including prescription, over-the-counter, herbal, and dietary supplements. It is very important to focus on the issues that pertain to the patient's surgery and undergoing anesthesia. This includes patients' known health problems and the status of those, cardiac and pulmonary status, prior personal or family problems with anesthesia, cardiac, smoking, alcohol, or drug history, possibility of pregnancy, any personal or family history of abnormal bleeding, or risk for anemia. The physical examination should include height, weight, body mass index, vital signs, cardiac and pulmonary exams, and any other pertinent exams based upon the patient's medical history. Any abnormal findings discovered during this preoperative basic health assessment would require further assessment to optimize the patient for their surgery. These findings could be a patient taking a diuretic that must have a potassium level drawn, or chest pain or elevated blood pressure noted during their exam. This further evaluation may be nothing more than asking a few more questions, a more in-depth physical exam, ordering lab work or chest x-ray or other x-ray. Some conditions may warrant further consultation by a specialist. It is very important to evaluate a patient thoroughly from a cardiac standpoint, especially patients with known cardiovascular disease. According to the American Heart Association, there are 27 million people that undergo anesthesia every year, and of those, 50,000 people suffer from perioperative myocardial infarction, MI, or a heart attack. The American Heart Association states that the definition of an MI has been broadened, and this will most likely lead to an increase in diagnosed cases of perioperative MI. This leads surgeons and anesthesiologists to request more consultations from cardiologists or internists to assist in preoperative evaluation and perioperative management of patients with known cardiac disease. There are many health conditions that need thorough evaluation to ensure that a patient is properly evaluated and prepared for surgery. These conditions include cardiovascular disease, diabetes, and sleep apnea. Medications and treatments used for these health conditions must be included in this examination. Some of these medications must be continued, some dosages may need to be reduced, and some may need to be stopped in preparation for surgery. There are many medications prescribed for cardiovascular problems. For patients that take medications known as beta blockers or cholesterol medications known as statins, it is very important that they continue these medications during the perioperative period to prevent cardiac problems. Patients taking anticoagulant medications must be instructed to discontinue these medications prior to surgery. Diabetes should be thoroughly evaluated. Patients must have stable control of their blood sugar during the perioperative period. This is very important in preventing surgical site infections. Medications for diabetes must be adjusted or held on the day of or evening prior to surgery. It is preferable for a patient to have a slightly elevated blood sugar during the immediate perioperative period. Many diabetic patients are extremely sensitive to changes in their treatment, so it is best to evaluate each patient individually. Patients should be screened for sleep apnea or symptoms of sleep apnea. This can increase a patient's risk of complications during and after surgery. If a patient uses a CPAP machine for treatment for their sleep apnea, they must be instructed to bring this with them on the day of surgery. Most laboratory and diagnostic tests should not be performed on a routine basis. This should only be done if a patient has a known or suspected condition. All patients 65 or older should have an EKG from within a year. EKGs are not recommended on any patient undergoing minimal risk procedures unless they have a known history that would make them a high-risk patient. A high-risk patient would be one with known diabetes, high blood pressure, chest pain, congestive heart failure, smoking, peripheral vascular disease, the inability to exercise, or morbid obesity. These patients should have an EKG from within the past year. The need for many lab tests is based on patient's history, type of surgery they're having, and medications that they take. Chest x-ray should be performed if a patient has symptoms of new or unstable cardiopulmonary condition. A pregnancy test should be performed on any female patient of childbearing age if pregnancy status is uncertain or suspected. Making sure that patients are properly prepared for surgery is crucial. Preoperative assessment and evaluation plays the biggest role. Patients must be in the best state of health possible in order to have positive patient outcomes. This preparation includes physical examination and review of history and medications, as well as education about their medical conditions, including instructions for medication use in the perioperative period. By ensuring that our patients have thorough assessment and evaluation done, we help ensure positive patient outcomes.